I can see that when he's walking, he skips a bit, and I can see he lifts the left leg a lot, and he still kind of go up the sofa, he doesn't go down, and sometimes you can see he makes some noise. That is my concern now.
You're such a spoiled boy. I hope it's something minor, it's just a tick or something that he's got and it's nothing serious. I just can't imagine going through the stress of uncertainty. We're gonna give the mouse to Leo. We're gonna give the mouse to Leo.
In my heart started, beating, saying, no, please, no, don't be anything serious.
You know what you went through, hey? Oh, you don't want your brother to get sick, his head's wrong, no. When I started seeing that Leo was limping, I thought to myself, oh gosh, we're gonna have to go through the whole surgery again. So Bella went into surgery and she was planning at the process of losing Oscar. So our friends all got together and decided they're gonna get Leo as a friend for Isabella just to boost up her morale. Leo, he's a ball of love. He filled a hole that we had in our heart, a big hole in our heart, and he's just precious, really precious dog. We just thought, oh my gosh, we're really unlucky to be in this situation again. But we have to sort this out because we can see he's not well. Fingers crossed, hopefully he'll come out of it without going through surgery or under the knife, because I can't imagine going through that whole procedure again, to tell the honest truth.
Now you're going to the vet, you're going to see the doctor, baby.
Yes.
Let's
You're
go.
going to the vet.
Look here,
Let's
baby.
go.
Isabella, do you remember where you are?
We're going to the vet.
You're going to see Scott.
Hello, good
How
to
are
see
you?
you. Very well, very well.
Hi,
Hello, Michael.
Scott.
Hello, pups.
Hello.
Hello, you two. Aren't they the most gorgeous couple? Aren't they?
Yes, they
Hey?
are.
Yin and yang. Hey?
Yes.
All right. Well, when are you guys coming in?
Thank you.
It's always great to see Michael and Anderson in the practice, but at the same time, you're always quite concerned as to what they're coming in for. They've had a huge amount of bad luck in the past with their animals who they adore, so I hope that it's not too serious this time around. So which one of this beautiful couple has come to see me today?
It's Leo.
It's Leo.
Oh, is that right? I know they're inseparable, but I think you've been through more than enough, haven't you, sweetheart? And she's looking great. She's been very healthy as well. She hasn't seen me for a while.
Amazing. Since she came from surgery, she's a different dog.
Gee, this guy has got some pressure on his shoulders. He's got to fill Oscar's shoes. And how's he been doing with that? Hello, mates.
He's been doing quite well.
Yeah?
The only thing, I don't know if it is a big concern, but sometimes when we play with him and we touch his leg, he sometimes cries, so I don't know if that could be an issue.
Yeah. Has anything happened to him that made you worry that, maybe it was an injury or?
No, nothing. It's just when he's walking or running, he quite often lifts the leg.
It's like a
That is
little,
my concern that something could be wrong.
One of the first things I can feel is that the leg on the left-hand side, the muscles there are smaller than the ones on the right. His hip now and just see what's going on there. Good boy. Oh, goodness. Oh, baby boy. So that's certainly where the sore bit is, isn't it, mate? Yeah, I can feel that the thigh muscle is definitely smaller than the right-hand side, and the discomfort is coming from his hip. So it's quite a obvious pain, and he seems to be quite painful. And even though he's not showing it at home, it might just mean that he is reducing the amount of jumping that he's doing, the running that he's doing. He's just being a quiet, sedentary little dog, and I know that they're quite keen on being cuddled and carried anyway. So, that's probably hiding a lot of the symptoms from you. So, I think the most obvious thing for us to do today is try and take some pictures of the affected joint, which is, of course, in the form of x-rays.
the yelp wasn't good news, was it? And that's not very promising when you hear him scream like that. So something must be really seriously wrong with him for him to be in such pain.
It's pretty obvious that there is an issue there, and it's definitely something that we all need to understand. You guys, I know, have been through a lot already, so we just need to make sure that we're not missing anything and that we're doing all the right things for Leo. Okay? All right. Okay,
Look
buddy.
after our dog for us, please.
I will. Yes, stay with Uncle Scott today. You give Daddy's a kiss, all right?
Okay. Come on, little.
Leo's not yet a full-grown puppy yet. He's already got such a serious issue. It is a bit concerning for us.
All right, then. I'll look after your chap, and I will see you in a few hours' time.
Okay, thank you.
All right?
Okay, thank you.
Okay. Bye, guys. Bye, Isabella. Say bye, Daddies. Say bye.
Okay, let's see our little Leo. Okay, there we are again. Hello again.
Hello again.
We had to see the results.
Indeed, the images are ready now, so
Oh,
if you'd like to go
wonderful.
on through.
Okay, thank
Thank
you
you
very
very
much.
Okay, no problem.
Come on in, gents.
Hi, Scott, how are you?
Yeah,
Hello,
very
Scott.
good. Come on in. I'll give you back your boy. Be nice and gentle with him. Because unfortunately, I haven't got the greatest of news to deliver. You guys really know how to pick him. This guy has a condition called leg-calf-Perthes disease. It's a mouthful, but it's a degenerative condition of his hip joint. All right. This is Leo on his back. This is his spine and his pelvis here. Now, on this side, you can see the whole section of that, the end of the femur, is a little bit longer. It's definitely abnormal. The shape isn't the classic ball. And what you can see is that big black dot in the middle there, which shows that already the femoral head is starting to collapse. It's starting to break down. And that's where the discomfort is coming from. Michael and Anson know me well enough to be able to read my face, and straight away they're anxious and upset. Sometimes life is just so cruel. So his hip joint is no good. It's cactus. It's such an extraordinary run of bad luck for these guys. They've had a dog that needed heart surgery. They've had a dog that was cruelly ripped from them as it got hit by a car. And now Leo has got a hip that's got some major problems with it. I mean, it's just so cruel.
What is the procedure now?
Sadly, the only way to fix this is surgery.
I think I wasn't expecting that at all.
No, it wasn't something we were
I
expecting.
thought something small, we can sort it here now and then. And you have to go through the knife.
Well, there's two very clear options surgically. One is something that I can do, which is removal of the femoral head and neck. And what it leads to is a free-floating leg, which sounds crazy because you think you've got to have a joint. But little dogs like this, they're very nimble, they're very light, and they can actually work very well with no hip joint. And it's the hip joint itself that's causing the pain in Leo, and that would be removed. The gold standard, however, is something called a total hip replacement. It is placing a false ball and a false socket into his hip and completely replacing the degenerate one that he's got. Now that's unfortunately not something that I can do. It's highly specialized, particularly in a little dog like him.
It's not very good news to hear that you have a little baby, such a small baby, has to go through it, unfortunately. And which, in your opinion, would be the better option then?
Well, guys, I'd say the gold standard, I think, is going and getting the total hip replacement. It's a massive surgery, but I think the benefits afterwards are considerable. And the fact that he is such a young dog and he's probably got a good 15 years to live, I think it's a worthy gamble.
A worthy gamble. I think we've got no choice but go for the better option.
Surgery again. Okay, yeah.
I think we're going to do the surgery, Scott.
hear about a total hip replacement, they're very concerned, but I think they're also resolute. They want the best for Leo and they're willing to hold his little paw through it.
Now,
Now we have to see Mike. It's going to be a big surgery.
oh God.
Hey. Now imagining the implant being so tiny and his bones being so small, and then cutting that bone of his to put that implant, it's a bit overwhelming. Hey. Yeah. Leo, every time he sees a dog, he just explodes. Shush. It's like a little monster that comes out.
Hello, Leo. He seems pretty chipper, doesn't he?
Yes.
Relaxed about the whole thing?
He doesn't know what is coming up. That's
go.
why.
Come on in. Small as he is, this left leg is a lot smaller than his right leg. He's lost quite a lot of muscle on that side as well, which kind of fits with his problem. He's been on for a little while, so.
Because we've noticed when he's walking, so he lifts up his leg all the time.
Yeah, bless him. Okay, that's great. So if you just give him a little cuddle then, I'll just quickly talk you through what it is and what the plan is. So you have standard hip replacement, which is kind of Labradors, German Shepherds, that kind of thing, which is this kind of size, I guess. And then they developed micro hip replacement, and now they've got nano hip replacement. He's a nano. He's a nano total hip replacement. Yeah.
Oh, shit.
The plan is that he's going to have a plastic on metal hip with no pain, with a normal range of motion, and he's going to be running around as a normal dog.
That's what we were
hoping
for.
That's the whole point. Let's go do a nano hip replacement.
Let's do
Okay,
it, yes.
right, follow me.
It's going to be really stressful until I get the call from Michael saying that the surgery's been all okay.
There you go. You want to give your daddy a kiss? There you go.
Good luck.
There we go. Right then. Michael, we'll speak later on.
All right,
Okay,
I'll
right.
be waiting for
Okay,
your
don't
call.
worry. We'll speak to you soon.
Thank you very much.
Come on then, you. Let's get you sorted out. Okay.
Always a funny thing to do, isn't it? There, Tickle. You're okay. There's a boy. It's okay. Good boy.
He's going to get an epidural for extra analgesia, but we're not going to put in as much local anaesthetic as we normally do because he might be a little bit wobbly after the procedure, which is exactly what we don't want when he's got his new hip in there. So we're just going to put a bit of morphine in there for analgesia. Now, some people would argue that this shouldn't be that painful, but I think if it was my hip, I'd probably rather have as much as I can get. So it's just a morphine with no local, and it's the local that would give him the wobbly legs. So, you know, want to keep him as comfortable as we possibly can do. The thing about Leo's hip replacement is he's tiny. There's very little room for error here. So the adrenaline right now is pumping.
X-rays. Take him.
The smallest one that they make, which is what we've got, is 10, and that measures 10. So it's a bit of a no-brainer in terms of selection of implant size. As expected, given these 2 kilos, it's the smallest one they make, and he's right on the edge. Right on the edge. Like I say, this measures 10, it's 10 millimeters. It's going to be on the wire. Right, we're going in. Leo's 2.7 kilograms. Smaller dogs have been done, but it's the socket that's the issue really more than the stem, because you could potentially doctor the implant a little bit with the stem, but not with the socket. So that's my big worry, is can we get a 10mm implant into a 10mm piece of bone with some cement at the same time. 11 scalpel.
Straight.
Yeah, okay, right, so we're off. It's not going to be very far in on this titchy little thing. So there you go. That's what we've cut off. So we've taken the femoral head and a little bit of the femoral neck here as well. The new femoral head looks a bit smaller. So this is grossly misshapen. It's almost went from a circle, which would have been a similar size to that. It's kind of shortened and flattened and kind of splurged out a little. It looks more like a mushroom. Flush and suction. For this dog, because it's so small and so delicate, we ain't going to be putting any reamers on power tools and press and go, because within half a second you could have no bone left. So that's not what we're going to do here. What we are going to do is we're going to use a little spinal burr, and we're going to use that a bit like a paintbrush and just remove the bone bit by bit by bit by bit. And just keep on seeing if our little trial 10mm implant will fit. And as soon as it fits, then we're good to go. Ooh, it's tight. It's really, really tight. So we just got to be very, very careful. The worry is we might run out of bone. If we go right the way to the side, that's game over. This has to fit fairly soon, otherwise I'm not quite sure. We can file down the stem, but there's not really an awful lot you can do about the cup. There's no room for error. So if I remove not enough, it ain't gonna fit. If I remove too much, well, there's nothing for it to grip. It's important that I don't go through right the way through and out the other side. Yeah, it's getting it's like wafer thin now. I can't go any further, otherwise I'm going to go through. So that's it. That's as far as we can go. Right, let's get the cement mixed. Go, 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 go. So Claire, you need to get around here. We're just going to now cement this thing in. So I just got to go for it now and hope it's good. Okay, so someone just count kind of 10 minutes or start the watch. If I move now as the cement starts to set, we're going to lose some of the bonding that we've got. But I think that looks from here quite good. Right. That's the socket there. If I move now as the cement starts to set, we're going to lose some of the bonding that we've got. But I think that looks from here quite good. Right. We're basically trying to make a hole inside the bone for this to fit with a little bit of cement around it. I can see this thing moving around inside the bone. Wow, that is getting really thin. If we go too far, we break the bone and we're a lot worse off than we were before we started. So yeah, that's a real kind of edge of your seat time. Oh, not quite.
Tight.
Do you know what? I need another millimetre.
Oh.
Oh. This is so tight. So basically what I'm doing, I just keep putting this thing back in, because if this thing fits, we're good. And I think that actually
Good.
is pretty good. We've got this implant now to fit, so this is it. We're just going to now cement this thing in. There's actually a very small window of when that cement is easy to work with and actually going to be effective to use. That you've got to put it in there and get your implant in, and then once you're happy, you've got to just stay put. Because if you start moving around as the cement starts to set, you're just going to debond the thing from the cement, and it's just not going to work. Very, 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 very careful. Right. So this is the actual implant. In she goes. And I need to just try and make sure that that is lined up.
She's in.
She's in. The fact that she's in is
Good.
is pretty damn good, I have to say. Whew. That, I think, is probably one of the fiddliest stops I've ever done. And that feels pretty good. Let's go X-ray, see what it's like.
Yeah.
Okay. This is now the really stressful way for orthopaedic surgeons because there's no hiding place on the X-rays, you know. I mean, worst case scenario, this hip might have popped out. That would be a total disaster, and I'll be crying. We need to get one of those. Go. Like
X-rays.
Fingers crossed. This view here is for us to assess the way that the stem sits in the middle of the femur, and it's really good. It's really good. It's in the middle. It's in for a start, so that makes me happy. Yeah, happy with that.
Oh, he's been such a brave little fella. We've got you a lovely soft bed for the night. There we go. He's so good. There we go. He's a good boy. Oh, it's all right. There's a good lad. There's a good boy.
One attempted jump onto the bed, and you know that hip could be not where it should be, and would be quite easy to snatch defeat from the jaws of victory here.
You got a new hip, mate. You're really lucky. Hey, he's a good boy.
Hey Maya, where's your friend Leo? Where is he? There he is. There he is, look, your little friend. Come on, you. 1, 2, 3. Oh. There we go, look. It's a bit of a one-off, to be honest with you, but he's the smallest hip replacement that we've done, and I just wanted to really, really keep a close eye on him for the first couple of days. Look, it's your little friend. Ah, gently. Ah, gently, gently. My God, 2 babies to look after at the same time, crikey. He's had a major operation and he's got better extension and is less painful than he was pre-op already. So, you know, I'm really pleased. Go say hello to Maya. There we go. Are you going to miss him when he goes home? You're going to miss him? Oh. Right, off we go. Right then, 1 baby in. Ready to go. Yeah. There we go.
Hello.
Oh, there you go.
Oh, he's chocolatey
There
baby.
you go. I had to bribe her with chocolate. She was getting tired.
Has she been all right?
Yeah, she's good.
Does she like Leo?
She loves Leo.
Oh. Come on then, you little one. Oh, good girl.
Oh,
Dad.
that's a bit more like it.
Did you help him
On
with
5s.
Leo?
Okay. See you later, Maya.
I'll see you later.
Excuse me. Hello,
sir.
Michael.
Hello, nice to meet you.
Nice to meet you.
How do you
Anderson.
do?
Oh, hello.
Okay, here he is. Here he
Hello.
is.
Can I? Sorry.
Easy
Oh,
does
come
it.
to daddy.
Easy
Come.
does it.
Yeah.
There we go.
Yeah, come to daddy. Yeah.
He's missed
Yeah. This morning at 7 o'clock I was awake waiting for the time to come here. I miss you so much, my little one. Yeah, you're going home now.
So he's been at our house the last 2 nights. You know, he's been getting waited on hand and foot. Anderson walks in and it's literally just, I'll see you later. It's quite funny.
Yeah.
most important thing is rest.
Okay.
And we don't want to be charging around off lead, because if he does that, potentially things can move around and we can get a problem. If he's good at 6 weeks, I'll be pretty happy. And then as his exercise increases and he's off lead at 12 weeks, and I get a video of him flying around off lead, then I'll relax.
Okay,
All the
now.
best. Okay, you take
you very
care. Take it easy. See you, Leo.
Let's see Daddy and Isabella. Yeah, they are waiting for you. Yeah, they are waiting for you, my little. Let's go home. See, Isabella, where are you?
Big kisses today. I first met Astro when the RSPCA were looking to foster cats out, so I said, that's great for me. I wasn't sure whether I was going back to Australia and it would be ideal. So what's going on today? What's going on today, for goodness sake? I went to meet him and he crawled up onto my lap and I said, well, you're the one. Straight away, he made himself at home. It was as if he'd lived here all his life. Astro was gorgeous straight from the start. You gonna go and see Scott? Gonna go and see Scott? Hey?
I think Astro has a massive sense of entitlement when it comes to old Isleworth. He thinks he owns the place.
Astro?
He goes to the pub.
How's Astro today?
He's good. You come in for a drink? What would you like?
Saucer of milk for the cat?
He gets on buses.
He normally walks all the way down to the supermarket and he just thought, I'll catch the bus. And he sat on the priority seats for the elderly. Good boy. He's a good boy today.
As he goes and checks out the barber shop.
Astro,
He is extraordinary. I think this guy needs a key to the city.
you don't get a haircut today. Astro, come on. Astro, come off that sofa, please. Come on, babes, come on. Astro, come on, you don't live here. I've had cats all my life, but I've never had one like him. He loves to go to other people's houses, and inevitably I get a phone call saying, your cat is in my house. And this has happened all over Isleworth. And people just fell in love with him. It's ever so strange. Get on the bus?
Despite the fact that Astro seems to be getting around old Isleworth perfectly well, he does have some issues that I'm concerned about.
Astro, come on.
His eye has got some issues and it has had for quite some time.
Come on.
In you come. Good boy.
Hi.
Come on.
Hey, Astro.
Good boy. Hello,
Hello.
buddy. Hello, mate. How's it going? You being a good boy? Hey, having a lovely day. Whenever we see cats coming into the practice, they come in a cat basket. Sometimes, but rarely, they come in people's arms, but never do they stroll in by choice on their own.
He's so unusual. I heard he gets the bus.
He does. I hear a new story about him every time she comes in.
He's famous.
He's very famous.
Famous in Isleworth.
Come in and see Scott. He's not that bad. Come on. Go in and see Scott.
Come on, mate. In you come. You know where it is.
Come on, Astro.
Come on then, this way. Every time Astro comes into the practice, you can't help but smile. This is an extraordinary cat. Good boy. So, look, I haven't seen him for a little while, and I must say his eye isn't looking that
No,
great today, is it? Definitely has changed a little bit.
He weeps on and off, and that
Yeah.
white bit has got larger. And one thing I noticed is he can't see very far away. Like if I go out of view,
Yeah.
like, you know, maybe 20 feet, he can't see me, I don't think. And then I have to come closer,
Yeah.
and then he recognises that I'm there.
Yeah, it definitely has changed a little bit. So Astro has had cat flu all his life, which is basically a herpes virus. And every now and again, when he's stressed, it comes out, causing injury to the surface of the eye, the cornea, and he gets corneal ulcers. These are chronic and ongoing, and as a result, his eye is scarred, and so that does mean it makes it more and more difficult for him to be able to see out of his eye. And he's now how old?
I think he's about 13.
Yeah, and he's obviously had herpes since a kitten.
Yeah, because he's had
So-
lots of flare-ups.
Yeah, so that's 13 years of flare-ups, 13 years of damage on that eye.
Yeah.
So first of all, just put a little bit of local anaesthetic into the eye just to make proceedings a little bit more comfortable. Hey, buddy, hey? Good boy. Good boy. I know.
I know, it's tough, isn't it?
It's only
Come
a
on.
couple of weeks ago. Oh, that's sweet.
Okay.
I know, come on.
He's fit
Come
up
on.
today. You are, aren't you?
Oh, I know. Your poor eyes. It's all right. I know. That little green dot there. Can you see that, Louise? Right in the centre of the eye.
Oh, yes,
So
yeah.
unfortunately, there is another ulcer present.
Oh, that's
So yet again, more scar tissue for this poor
Oh.
eye. The concern I've got is that the changes that I can see on the surface of his eye might actually impede his independence. This cat needs to have 20/20 vision to be able to get around, and I'm really concerned that it's deteriorating of late. The eye is far from normal. Far from normal.
Oh, Astro, you've got herpes.
Mummy, don't say it so loudly, hey? We don't want all the neighbours to hear, do we? They won't let you in anymore.
Oh, babes. Astro's my little mate. He's adorable. I'd do anything for him. Yeah, he's a little treasure. So I'm worried something could be wrong with his vision. I'd hate him to have to lose his eye. Astro, what are we going to do if you can't go out? Hey?
Today on examination of Astro's eyes, I can see that he has got some ulcers again, bless him, which are a little bit sore and of concern. Right now, I'm really worried that he could actually lose his sight. He's got a huge amount of attachments from the iris to the lens, and that is completely abnormal. So it's hard to know if that's because of this herpes virus or not.
I'm worried about Astro's eye and worried about what life he will have if he loses his eye. He loves to go out and wander. I don't want anything to hamper that. He's a good boy, hey? I think Astro would be miserable if he was confined to the flat because he loves to explore and he's got a big life and a big wide world out there that he loves to go out and see.
Louise, I know how much you love this cat and how much he means to you.
Yeah.
I mean, this cat really is one in a million. He is so special and he just deserves the best of care. We need to ensure that this guy keeps doing the extraordinary things that he does. The good news I can deliver is with the right management and time, we'll get on top of this corneal ulcer like we have before. But it is looking more and more abnormal. But I'm just really concerned that if his vision continues to deteriorate, it makes it more and more difficult for him to keep himself safe.
Do you think he can see out of it?
He can. You know what it'd be like? It would be like if you got your glasses, you took them off, you went, and you put them back on again.
Oh, so
it's like looking
foggy.
through mist. Yeah.
Oh, okay.
Yeah. So we can treat that, that's fine. We'll continue to do that. The good news is that there is light getting into the back of the eye.
He loves life, he loves it. So I'd like to see him have it at its best.
Well, let's go and get the best for you, shall we?
get me
Shall we get the best for you?
So I'm not quite speaking to you yet,
No.
Scott.
Hey?
Almost.
You're a bit mad at me, aren't you?
Yeah.
You're a bit mad. I couldn't believe it that even after a really long consult where I was annoying him and putting dye in his eye, that he still wanted to give me a bit of affection. He wanted to rub heads with me while sitting on the weigh scales. It might have looked like he was butting heads with me. He wasn't. This is definitely all bromance. And I can totally understand why everyone in Isleworth has totally fallen in love with this cat. Treating Astro is always fantastic fun. And at the end of doing it, he was a perfect gentleman. He sort of tipped his cap to me and then just decided to jump off the table and then saunter out of the clinic.
Astro.
Boy.
Boy.
All right, mate.
You ready to go home now?
You want to go home now?
Torch is over.
Hey, you want to go on the
Come
dog
on.
scales instead?
Come on.
Astro, he's a totally awesome cat. And for now, our intrepid explorer can continue to enjoy his jaunts around Isleworth. Long may he reign. Going to be our new window display. Yep.
And what would you like to drink today, huh?
glass of
Milkshake,
milk.
maybe? Hey, nice cocktail. What do you reckon?
Prawn cocktail.
Prawn cocktail crisps, yeah? Scampi fries, yeah? There we go.
I think he does. I think he's sharing himself. He's sharing the love with the whole neighbourhood. Everybody that knows him loves him.
So that's it for the day.
Just comes in for a mosey.
As long as the cat doesn't creep down in the night and help himself to my beer.
I don't know, he might actually. You like a drink, don't you, Astro? I'm looking after him, he looks after me, he's great company. He's just adorable. He means the world to me. I think perhaps it's destiny that maybe Astro and I are together.
It's not the thing you see every day, is it? Cats walking around in pubs. That's what he does. That's true. On another planet.
Leo.
Leo, come on. Where's the ball?
Go, 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 go.
Leo, where's the ball? Leo's doing really well. We're really happy with the outcome of the surgery. Fetch, 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 fetch. No more surgeries, no more nothing.
Touch wood.
Touch wood, yes. Because the thing is,
it's a bit too much.
for the last 2 years, it's been a living nightmare. And now, hopefully, it just
Maybe
be
it's just
happy
happiness.
days.
Happy days.
Just happy days from now on.
Hopefully. Praise the Lord.
Hello there, gents. This is a happy scene. Good to see you. Hello, puppies. Hello. How are you, Leo? Leo is dancing away, chasing balls with Isabella. It's a massive difference from the last time I saw Leo. Good boy.
Good boy.
Wow. Where he was constantly lifting his leg up, he was in pain. But now Leo is walking comfortably and beautifully in the park. Okay, let's have a little look at him, shall we?
Yeah.
Hello, mate. Oh, that's good extension. It feels beautifully smooth, it's moving well, and all the muscles and support tissues around that hip are doing very well, so it's a really good result.
Oh, happiness.
All happiness, no more surgery. Guys, agreed?
No more.
I think he does.
Resounding yes.